Hello, welcome back. The video topic today is nausea and vomiting. So most of the time, at least once in our lifetime, everybody would have experienced nausea and vomiting. What is nausea? Nausea is like feel like vomiting, but you don't vomit. But the sick feel will be there. Vomiting is whatever the content in the stomach that comes out. It could be food or even only water or even acid, bile, everything can come out. That's called. It could be voluntary induced or it could be natural disease induced. Okay, and very importantly, nausea, vomiting are not diseases. They are all signs and symptoms of some other disease. So it's only a signs and symptom. It's not a disease at all. So whenever you have a nausea, vomiting, look for what could be the reason. Okay, very simple. Okay, and most we all know, at least once we got that kind of thing, but we all know one of the most common reason for nausea, vomiting is pregnancy. Almost 80 to 90% of the women experience during pregnancy nausea and vomiting, and of course that needs not much of a treatment. That is mainly because of hormonal changes, and the growing child can push all these things out. This is one part. The other reasons for most of the time nausea, vomiting is medicines what we are taking, like most of the time painkillers, antibiotics, or even aspirin or even iron tablet. All these things, when you take it for prolonged, diabetic medications, BP medications, when you take for prolonged, they can irritate the stomach, causing acidity, gastritis, and nausea, vomiting. Most of the people, when they get up in the morning, they feel like nausea and vomiting, and when they're brushing, they always throw up. These are all signs and symptoms of stomach problems. So even the indigestion can cause nausea, vomiting, and your food poison, something very bad or something infected one. When we eat, you have that nausea, vomiting. And suppose you have a problem with the gallbladder, it can be appendix problems. They can cause nausea, vomiting. So even people with brain infection, children, especially children, brain infection, or even somebody is in a severe pain. Pain itself can cause nausea, vomiting. Stress can cause nausea, vomiting. So it has a range of reasons. The spectrum is huge one. So, but it's only a signs and symptom of an internal problem. Even people when they travel, motion sickness, when you're traveling very fast, or they're doing giant wheels, all these things, strings, all these things can come. That's called motion sickness, seasickness. All these things can cause nausea, vomiting. And again, it's only a signs and symptom of an internal cause. So we should look for what could be the reason. So if you have more than one day of nausea, vomiting, and it frequently disturbs your daily life activities, and you have to see the doctor will look for what could be the reason with a history, examination. Even sometimes you ask for a ultrasound, endoscopy, blood tests, and to other things. And once he finds out this could be the reason, then they will they treat you accordingly. So nausea, vomiting is not a disease, it's a signs and symptom of an internal problem. So accordingly we should take. So once somebody gets nausea, first and foremost we say is avoid spicy, oily food, or complex food, or something to digest hard. Avoid all those things. Have a very simple bland diet. Have clear cold liquids, ice water, plain ice water. Maybe if you are dehydrated, you can add some sugar and all, or even some salt based clear liquids, you can have it. But always, if it is more than 2 days, or look for what could be the reason. Then you may, sometimes the doctor may give you to treat your stomach problem, like pantoprazole, rabiprazole, antacids can be given. Sometimes antibiotics will be given. Or suppose you have a problem in the ear, they treat the ear, so your nausea, vomiting comes down. So nausea, vomiting is a very common problem. It's not a disease, it's only a signs and symptom. So if it is more than 2 days and it's really disturbs your day-to-day life activities, go to the doctor, look for root cause and get it yourself treated. Thank you.